Good afternoon, everybody. I am Dr. Collins from Bilkent University, Tourism and Hotel Management Department. I am here with my students today. Me and my students are here to share our experiences from one of senior projects of Spring 2020. I would like my students to introduce themselves before they start their poster presentation. Here we go.
Yes. Firstly, I'm Tahir Serdiç Selenay. I'm a fourth year THM student, and that's all.
Okay.
Öykü, ladies first. Would you like to go first?
Thank you. My name is Öykü Baratan, and I'm also fourth year student of THM.
Okay.
My name is Noyan Anil Yüceler'in. I am also fourth year student of THM.
This is Mehmet Bahadır Özgüvney, and this is my fourth year in Tourism and Hotel Management Department, and this is our project.
Okay, very good. Let's share our poster. Okay, who will start?
I will start as the aim of the study. So let me say again, good afternoon, everyone. Today we make a study about COVID-19 in hotel industry. So firstly, our study is taking a part of COVID-19's effects in tourism industry. As you know, on the December of 2019, there is an outbreak raised in Wuhan in China. So this outbreak made it bigger and spread to world. Then in March 11th, it comes to Turkey, unfortunately, and it makes itself bigger and made ourselves stay in our homes. So it affected a lot of industries, especially firstly in tourism industry. So our study is aiming to find out how the COVID-19 affected tourism industry. And me and my friends will talk briefly about this COVID-19's effect in tourism industry. And I will lead the words to my friends.
Okay, thank you, Noyan.
Thank you, Anil. Firstly, I'm going to talk about the methodology and mention about our methodological approach, which is a qualitative method. We ask ourselves what is the most suitable approach to answering our research questions. So in the table poster, you can see our research questions. Firstly, what was the immediate effect of COVID-19 to the hotel industry regarding the volume? And secondly, what are the immediate precautions taken? And lastly, what are the future possible precautions if this virus spread more? So we consider validity and reliability when we choose our methodology. So in order to gain in-depth insight into how COVID-19 affects hotel industry, in order to get a real world knowledge, we did choose qualitative method. So we took our data from the interviews, online interviews mostly, from the current employees of 5-star hotels. So first we did find and choose our participants thanks to our personal contacts in the hotel industry. And there were 8 participants who take part of our research. And mostly their age between 24 and 28. And only one of the participants were women. So in our context, there were seven hotels, and which they located mostly in Ankara, and secondly Istanbul and Bodrum. So we couldn't balance the resort hotel and city hotel order. So mostly we choose interviews, and the interviews were structured. So we make our interviews and ask the same order to every participant. So it took approximately 30 minutes, and we were recorded by cell phones with PCs, and the interviews took two parts. First, we asked the demography of participants, such as departments, positions, gender, age. And secondly, questions about our research. So exploring the COVID-19 situation and precautions they're going to take, and suggestions for their future situations. So, but we were limited by some situations. For instance, we are living in the COVID-19, and this limits our research. So this leads to we couldn't do our face-to-face interviews, and we didn't have enough time to research and find more participants. Also, we are a little of lack of interviewing experiences, and because all of that, the research needs to further research types, and that was our methodology, and our friends will talk about results.
Okay, thank you. Thank you, Serdiç.
And I will talk about the results section. So in results, we have 4 subtopics that I would like to inform you about. First, one of them is demography. I will inform you about our participants' demography. Then we will talk about effects of COVID-19 in hotel industry, precautions taken by hoteliers, and suggestions to overcome the negative impact of COVID-19. So first of all, I would like to inform you about our participants' demography. We had 8 participants, and their ages averagely between 24 and 26, and 87.5 of them were male. And we asked them, our first question was, is your hotel open right now or closed, and why? And their answers were open. And their answers is the reasons for continuing to help our long-term guests staying at our hotel without leaving the hotel, keeping the costs at the lowest level, not to miss possible room revenues, and paying staff salaries when other hotels are closed. This is one of our participants' answered.
Bahadır, if you can keep yourself close to the microphone, sometimes your voice is not strong enough. Okay, sorry about interrupting you. Yes, so the first question was if the hotel is open or closed. Yes.
And if it's open, why is it open? And if it's closed, why is it closed? And in one of the open hotels, we asked our participants, we asked the reason why they are still open. And she answered like, the reasons for continuing to help our long-term guests staying at our hotel without leaving the hotel, keeping the costs at the lowest level, not to miss possible room revenues, and paying staff salaries when other hotels are closed. We have one more answer for this. We have all of the participants' answers in our project, in our research paper. Since our hotel is a summer hotel, our hotel operates in full tanks in the summer. Our hotel management has decided not to open it in order to prevent the spread of the corona and to prevent financial damage to the hotel if it's open. So this answer, one of the hotels which is closed. And we have effects of COVID-19 in hotel industry. We all know it has negative effects, and all of our participants' answers are similar in this topic. And I would like to read you two of the answers. First one is tourism has come to a halt, and this summer season will likely drop by 80%. The occupancy of 5-star hotels that are currently open is around 20%. This is one of our participants' answer again. And the other one is occupancy rates fell unprecedentedly. We started to think and implement solutions we never had to think about. All services were stopped except reception, room service, and housekeeping. So we can understand that they are minimizing the cost. We have the topic for precautions taken by hoteliers. And when we observe that precautions taken by hoteliers, we have two subgroups again, the precautions for the hotel and precautions for the staff. So in precautions taken for the hotel, we have three subgroups again. It's precautions taken for guests, precautions for daily operations, and precautions for financial stability of the hotel. In precautions taken for the guests, I would like to read two answers again from our participants. One of them saying that apart from that, we checked everyone at the entrances with safety thermometers. And the other answer is, I can say that everyone who enters the hotel has a fever measured. And the other topic is precautions taken for daily operations. Our answers are like in housekeeping, employees were provided with masks, gloves, and glasses. Cleaning teams came and carried out their disinfection at certain intervals. Especially the housekeeping team kept cleaning the rooms constantly. The other answer is, we try to minimize social contact. The areas where our guests are located, most are constantly disinfected. So they're fighting with the virus in this way. So we have the precautions for financial decisions, financial stability of the hotel. I would like to read again two answers from our participants. We are trying to keep our costs at minimum point. Otherwise, our daily operation costs will cause to close our hotel. And the other answer is, an application was made to the short-time working allowance. Salaries for March were paid. A state aid response is expected for April. So they are expecting help from the government. And we have the precautions taken for the staff. So this is so important because staff is everywhere in the hotel, and they need to be disinfected. And our first answer is, since this coronavirus threat began to provide training employees, the hotel management began to be seen in Turkey, and the employees were changing shifts of workers, tried to provide less contact. And the other answer is, paid leave for all other employees, transition from home to short working periods, maximum 30 hours per week. All non-essential expenses were deducted. And we have suggestions to overcome the negative impact of COVID-19, and our friend Öykü will mention about.
Okay, thank you. Thank you. Öykü, before you start, I would like to ask Serdiç about our time management.
Yes, we have approximately 15 minutes.
15 minutes. Okay. Yes, Öykü. Sorry about that.
No worries. So in this part, we will provide the summary of the suggestions coming from the results of the study and the researchers' insight. Participants mentioned that precautions for the staff have been taken after the first case identified in Turkey on 11th March. After everyone realized seriousness of the situation, precautions have been expanded and implemented in different areas such as compulsory annual leave, leave without payment, laying seasonal employees or short-term employment. And I would like to introduce our suggestions throughout the negative impacts of the COVID-19 for hotels. First, hotels should have crisis plan how to support their employees financially. For example, employees should not be forced to take annual pay. Managers should respect employee rights. The results show that strong international chain hotels were faster to identify the crisis and taking precautions. Therefore, we suggest that future employees should prefer to work in those hotels. the study has limited participants due to COVID-19 quarantine. Future researchers should conduct studies with more participants. After the crisis, hotels should plan trainings to employees for future crises. Hotels should have think tank meetings about crisis times. And hotels should plan disinfection application as a regular days as well without this COVID-19 issue. And it is bad. So I would like to give some other suggestions from employees that we collected from the employees. First one is, it is best to get rid of this virus completely if people stay in their house. But if the hotels do not open in the summer season, many people will be unemployed and tourism will be crushed under great losses. The ministry must provide assurance to hotels and employees. And we have one more. Follow the government regulations. Make investments that keep you stand financially. And the last one will be, there is a plan for crisis in the hotel for situations such as natural disasters, fire, terrorist attacks, etc. But a plan for a crisis of this magnitude has never been considered. A plan can be designed for the future, hoping not to happen again.
Yes.
So these were the suggestions from our part and our participants.
Okay, okay. Thank you, Öykü. I would like to add just one more thing about the limitations. First of all, thank you all of you. You did a great job. As for the limitations, since you started the project just after Corona, lack of motivation to answer your interviews were one of the limitations. I experienced that you had a hard time to persuade employees to talk to you. That is why we had to limit the number of employees, 2 employees per senior project students. Otherwise, if there is the motivation, you could have reached more employees, I believe. Maybe after that COVID-19, some researchers will have a large-scale qualitative study to check for the effects of COVID-19. Okay, Serdiç, how many minutes we have?
Approximately 10 minutes.
10 minutes. Okay, then why don't you, each of you, take turn to tell your experiences, 1 or 2 minutes, then we can close our session. Thank you very much.
So I would like to start, if it's okay.
Yes, why not?
We started this project as before this virus started in our country, actually. So it was in foreign countries firstly, and it was around February that it was certain that we will be having this course. So we will just chatting with Ayşe Hoca, and then we just decided, why don't we have this project? And we started talking, and we were asking to other classmates, of course. Actually, we started way earlier than the COVID-19 in Turkey. So
yeah.
it was a nice experience to have such a project because we started, then this COVID-19 came to our country, and it was, as you mentioned, it was hard to find participants to have answers.
Yeah.
So it was difficult, but a good experience.
Yeah.
Thank you.
So you had a real-time experience. Okay, thank you, Öykü. Anybody can take the floor.
I can talk.
Yes.
As Öykü said, we had some limitations because people wouldn't like to participate this too much. because they are already suffering a lot because of the virus, because of the uncertainty of their jobs. What are they doing? They had a lot of questions in their minds, but they helped us, and thank you for that to all of them. And but it was a nice topic because it's a current situation that we are suffering a lot in our country. And besides the limitations, it was fun to have a research paper on this, have a research on this. And we are know more things about the coronavirus right now and how it affects our industry. So it was nice to working on this topic.
Okay, if one of you, Serdiç or Noyan, if you can just talk about the review of the literature, how you started reading to have our research, what kind of readings you had, the review of literature. If any of you can give some idea, it would be better.
I would like to talk on this purpose. So firstly, to be honest, we never thought this situation come to our country and get this much bigger. So as my friend said, we started this topic without a case in our country. So we read articles about COVID-19 in countries like China, Italy, Germany. Then we made some questions about this case. What if, like, what if happens, if it comes to our country, then it became real.
What was the, sorry, what was the similar case when you look at the articles? What kind of articles you read? What was the similar case? Serdiç, do you want to add on that?
There were some similar cases. It was called SARS.
Yes.
We were firstly mainly focused on the SARS. Then it is called like SARS-2. But our mostly review of literature and our most article was talk about SARS and how it affects. It is economical effect. It is effects on the world. We were mainly investigated those articles actually.
Yeah, and like Noyan said, you looked at the very immediate, early readings from other countries, and you based your knowledge to conduct the study.
And since it's a current topic, sometimes it was hard to find an article about it, but we read articles from World Travel Organization, and we had some articles about SARS crisis also. It was a similar crisis with that, and we had the idea for the coronavirus from those articles.
And how to conduct this research.
You learn how to conduct a real life research. That was the best experience for you, I believe.
I think we evolved during this research. It changed during our research time, I think. Yes. Okay, Serdiç, did we do a good time management? Yes, I think we've done it great.
Okay, I would like to thank all of you again, and I believe you will be good researchers in the future. Thank you all.
Thank you very much.
Thank you.
Thank you.